All righty. So I hope everybody had a nice Thanksgiving. Hope everybody is safe and comfortable right now and at home. What we're going to be starting today is the muscles. We're going to be going through the muscles that are going to be on your practical. The muscle practical will be the Wednesday of week number 4. It'll be the Wednesday of week 4. We also changed the bone practical. The bone practical is no longer on week 1. The bone practical will be on the Thursday of week 2. So this way you guys will have more time to study, and that's including an extra day off for the Martin Luther King holiday. So that Monday of week 2, you will also have off. So you'll be able to have some extra study time. Like I said, if you guys are welcome to come in here, make an appointment with me. And if you want to work on the bones, please send me an email, and we'll set something up so that you guys can work on the bones. Again, we have another 3 weeks before classes end. Then we have a 3-week vacation. I don't know. I try not to come onto campus during that vacation, but if you guys pick a day that most of you are going to be here, I'll come in. All right, I'll come in because I'm at this moment we're not going anywhere, my wife and I. So, all right, so let's get on the muscles, and the muscles that are going to be on your practical. Was it 42, 43, 44, 45, 46? There's 46 muscles on your practical. So that sheet that says muscle identification, there was, I believe, 44. And I added the sternocleidomastoid and the erector spinae group. So we will go through them. So when we're talking about the muscles, Ben, do you see this?
Yeah, I do.
Practical muscles, fantastic. So these are the specific muscles on the practical. What I'm going to do is I'm not going to send you guys this one. I'm going to send you guys the entire muscle PowerPoint tomorrow, because there are more muscles that you guys are going to be required to know. All right. These 46 are going to be on the practical, but there are other muscles that you guys are going to need to know. So I'm going to send you the PowerPoint with all the muscles, and we'll be going over that tomorrow. So when we're talking about the muscles, it's very important for you guys to understand where the muscle is located. So it's going to be really important for you to understand the muscles around the muscle that you are looking for. I mean, so if you have muscles on the anterior side, like pec major and pec minor, and you have some muscles on the lateral side, like deltoid and supraspinatus, and you have some muscles on the back, on the posterior side, like infraspinatus and teres minor and teres major, latissimus dorsi. It's good to understand where these muscles are in relation to other muscles. So this is just a diagram to give you an idea of where these muscles are in relation to one another. The next couple of diagrams are more of the diagrams that you'll see out in the field. This screen and the next screen will show certain muscles that are superficial that we spoke about, that are close to the skin, like pec major. And then we have muscles that are deeper, like 2 pec major, like pectoralis minor, and coracobrachialis, which is directly under the pec major. And it's very, very important for you guys to understand where these muscles are located, whether they are superficial, whether they are deep, because it's going to be important as we go on. Like when we're ready to treat these muscles, for instance, when let's say we're going to treat it, we're going to do an ultrasound, and you need to know how deep that muscle is, because we don't want to overheat an area. We can actually burn somebody. So it's very important to understand what muscles are superficial and what muscles are deep. And again, here's another screen showing the muscles in relation to one another. This is showing the anterior and the posterior. All right, so let's start going through these muscles. The first muscle, the sternocleidomastoid. All right, you can know this muscle as the SCM. Now, the SCM has an origin at the sternum and at the ribs, sternocleido, and an insertion point on the mastoid process up here. I don't know if you guys know, but let me tell you that the way a muscle contracts is it contracts with the insertion going towards the origin. So in this muscle's case, it's contracting in this way. It's bringing the mastoid process closer to the sternum and the clavicle. So it's very important to understand where the origin and insertion is, because that's going to tell you basically how a muscle moves. And we're going to go more into the muscle movements tomorrow and the specific muscles and what they do. But what I want you to understand is where this muscle is located. And this is a very, very superficial muscle. If you can actually feel it on yourself, if you were to try to take a carotid pulse, you would actually be feeling for the sternocleidomastoid and for the scalenes, and you can find your carotid pulse between those two muscles. So this muscle looks like a strap, and it's located with the origin on the sternum and the clavicle, and its insertion point is on the mastoid process. It also has an insertion on the back of the head on the nuchal line. Not that important, not something that we are too concerned with. Okay, so again, sternocleidomastoid. Next muscle. Well, I also want to remind you guys of this ligament. This is not something that's going to be on an exam, but I want you to know that there's a ligament basically going from the occiput part of the skull down towards C7. And this is a fibrous ligament. It's known as ligamentum nuchae. And basically what it does, it served a couple of purposes. It's an insertion point. It allows for muscles to be inserted into that area, but it also keeps the head from flexing forward too much. So it actually protects in movement. But more importantly, this ligamentum nuchae, this deep ligament, is an insertion and origin point for certain muscles. Again, when we're talking about the chest muscles, we're talking about a few different muscles. And again, you have to understand what muscles are superficial, what muscles are deep. The sternocleidomastoid, as we showed, is a very, very superficial muscle. The pectoralis major, all right, superficial. Deltoid, superficial. The biceps brachii, these are muscles that you can easily touch on yourselves. But then we have those other muscles that are very, very deep, that are deeper, such as pectoralis minor, coracobrachialis, the serratus anterior. And these are all muscles that are underneath those superficial muscles. They can still be treated, but they would be treated in a different way. The next muscle you'll need to know is the pectoralis major. Pectoralis major is basically your chest muscle. This muscle also has multiple origins. The origins are on the sternum and the clavicle, but its insertion is on the humerus, close to the greater tubercle, but more in the bicipital groove of the humerus. So pectoralis major, your chest muscle. All right. And what I'm also going to do is after I go through this PowerPoint, I'm going to show you guys what these muscles look like on the flashcards also, since I'll be using a bunch of flashcards on the practical also. So pectoralis major, pectoralis minor, pec minor, again, this is a deeper muscle under the pec major. It comes off of the third, fourth, and fifth rib, and it inserts onto the coracoid process, which is one of those bony landmarks on the scapula that you'll be needing to know. The next muscle is the latissimus dorsi, also known as the lats. You'll be seeing it as lats also. This is a very wide, expansive muscle. This muscle has multiple origins, and you need to understand where these origins are at. So they basically goes from the vertebral spines from T7 down to the sacrum. It's on the iliac crest. It's also on the lower four ribs, and it has an origin on the inferior angle of the scapula. So it has multiple origin points, and it affects all of these points when it moves because this muscle has multiple movements. This muscle also, like the pec major, also inserts into the bicipital groove. It's literally on the floor of the bicipital groove underneath the long head of the biceps tendon. So again, tomorrow we will go over all of these actions. We'll be much more specific with it. But this is what the latissimus dorsi looks like, a very wide, expansive muscle on the back. It's on the back, but it also has actions at the shoulder, all right? Has very important actions at the shoulder because it attaches on the humerus. The trapezius is that large superficial muscle in the back. It has a very triangular look. There are three parts to the trapezius. We'll go over those tomorrow, and you'll have to know them for the exam. But on the practical, you'll basically just have a picture that has the trapezius looking like this and looking like this. This is basically how the picture is going to look. It's a very expansive muscle on the back. It goes from the back of the occiput all the way down to the lower thoracic vertebra. It also there's also attachment point and insertions on the clavicle, on the acromion of the scapula, and on the spine of the scapula. So again, this is a very large muscle. It has multiple actions also. But again, when you see it on your practical, you're not going to have to know the three parts. You'll have one trapezius, one muscle, and I'll show you on the card what it looks like in, a little bit later. But all you'll have to do is when you see this muscle in this form, in this triangular form, all you're going to tell me is that's the trapezius muscle. And then we will go on from there. Next muscle is the rhomboids. Now, the rhomboids, we do have a rhomboid minor and a rhomboid major. The rhomboid minor is small and superior to the rhomboid major, which is below it. This is a muscle. These are two muscles that go from the spinous process of the vertebra to the medial border of the scapula. What I'm going to ask of you is that you're not going to need to know the rhomboid minor and the rhomboid major. I'm going to want you to know the two muscles as basically the rhomboids. Okay, so when I show you this picture like this, all I will ask you is what muscle group is this? And all you would tell me is the rhomboids. You won't have to tell me this one's rhomboid minor or this one's rhomboid major. Because on the national exam, the rhomboids are very, very specific. They both do the same thing. The only difference is their origins and insertions, and they're so close together that there's really no differentiating the two. All right. So you'll notice on the bottom of this screen, I put the origin of the rhomboids as the spinous processes from C7 through T5, and the insertion is on the medial border of the scapula from the scapular spine all the way down to the inferior angle. So again, when we're talking about rhomboid minor and rhomboid major, you're not going to have to get specific with that one. All you got to tell me is that this is the rhomboid muscle. And rhomboid, if you remember your geometry classes, is basically it's a diamond shape. All right, rhomboid is diamond, and that's what the shape is of these two muscles together. The next muscle is the serratus anterior. Serratus anterior is a tough muscle. For those of you that work out, this is the punching muscle. All right, this is the punch muscle that allows people to punch forward. The serratus anterior does something known as protraction of the scapula, where it moves the scapula forward. Well, the serratus anterior starts, its origin is actually on the first 9 ribs. Then it goes underneath the scapula and attaches on the medial border of the scapula itself. Tough muscle. When you're palpating it in kinesiology, the only way you could palpate it is if you protract it with resistance. You can see it and palpate it on the ribs itself. So the serratus anterior, and serratus basically means rough cut, and it looks like a rough cut muscle, like a paper has been torn, and that's what the serratus anterior looks like. The deltoid, it's the superficial muscle over the top of the shoulder. This muscle, like the trapezius, has 3 parts. On the practical, you will just need to know what this muscle looks like. So again, when the muscle will look just like this, it'll have this, and then it'll go down here like this. This is what it'll look like. You're not going to have to tell me about the anterior, middle, and posterior. That you'll have to talk about and answer questions on my quizzes, right? There are 3 parts to the deltoid, but on the practical, it'll look like this picture. All right. This is a very superficial muscle. All right. This is the most superficial muscle and probably one of the stronger muscles of the shoulder itself. So the deltoid. Now, we need to understand these rotator cuff muscles These muscles are muscles that are deeper to the deltoid, and they have a correlation to the deltoid. See, the deltoid actually wants to pull the shoulder, wants to pull the glenohumeral head out of the socket because it's so strong. But it's these four rotator cuff muscles that keep the glenohumeral head in the socket itself. They have a correlation, and you'll learn about that in kinesiology. These muscles are some of the most important muscles that we work on as physical therapist assistants. It keeps us in business a lot of times. So you have got to know these muscles. All right. The four muscles creates what they call the rotator cuff. And it's not the muscles themselves that create the cuff, it's the actual tendons of the muscle. Those tendons actually go over the glenohumeral head and protect it. So the rotator cuff muscles has an acronym. The acronym is known as SITS, and it basically describes the first letter of their names. Supraspinatus, infraspinatus, teres minor, and subscapularis. Those are the four rotator cuff muscles. Again, it's the tendons that hold the head of the humerus. The tendons of these rotator cuff muscles that holds the humerus in the glenoid cavity. And just so you know, the supraspinatus tendon is the most easily damaged of the rotator cuff muscles because of where it is. All right. And it's injured most of the time due to something we call as an impingement. An impingement is where the muscle and the bone are actually making a connection. Well, when muscle hits bone, there's more of a chance of that muscle tearing. There's not a lot of give in that muscle. Those bones are darn hard. All right. And if there's an impingement, it's usually the supraspinatus muscle that gets impinged. This is what the rotator cuff looks like. So these are the four muscles. So the picture on the left side is the posterior look. These muscles basically are on the scapula. So on the posterior side, above the spine of the scapula, is the supraspinatus. Underneath the spine of the scapula is the infraspinatus. Kind of makes sense. Supra meaning above, spinatus means the spine. Above the spine, supraspinatus. Below the spine, infraspinatus. On the lateral border of the scapula is the teres minor. Those three posterior muscles all insert into the greater tubercle. All three of those muscles insert into the greater tubercle. On the right-hand side picture is an anterior look of the scapula. This is showing the scapula from the anterior side. Only one of the rotator cuff muscles is there. That is the subscapularis. The subscapularis inserts into the lesser tubercle of the humerus. So we got the first three attaching to the greater tubercle, and we got the subscapularis inserting into the lesser tubercle. So let's look at each one. The supraspinatus, again, this is a posterior look. You can see the clavicle in the front. You see the spine of the scapula in the back. The supraspinatus goes right under the acromion process. And it's that acromion process that sometimes hits that supraspinatus, creates an impingement, and causing a tear. Now, I can actually impinge you guys right now, and I want you to try this. Put your hand down to the side, and what I want you to do is put your thumb downwards. Put your thumb down, and I want you to move your arm out to the side. All right, don't force it. It's going to stop. Okay, don't force it. It's going to stop. So your thumb is down. What's happening is at that point in time, your supraspinatus is actually hitting your acromion process. Now what I want you to do is with your thumbs upwards, I want you to do that same movement. Bring your arm out to the side. So Ben, which way did you go higher? Did you go higher with your thumb up or your thumb down?
I'm still trying to figure it out right now.
Okay. I don't know if you can see me. Okay. My thumb is, go with your thumb up first. Thumb up like you're going to hitchhike. You're going to abduct your shoulder. You're going to bring your arm out to the side with your thumb upwards. You can go almost over your head, most likely. Now bring it down. Put your thumb downwards. And now do the same motion.
Thumb up all the way.
Thumb up. You don't go as high with your thumb down, do you?
No.
Yeah, what you've actually done is you've actually impinged yourself. You're actually pushing the acromion process into the supraspinatus because it's the supraspinatus that abducts the shoulder. So you're actually keeping it from moving just by changing the position of your hand. Pretty cool stuff. Don't worry, I'll show you another trick where you actually lose your bicep muscle in a few minutes. The infraspinatus. The infraspinatus is again on the posterior portion of the back. This is a muscle that is below the spine of the scapula. That's the second rotator cuff muscle. The teres minor is the third rotator cuff muscle. I'll come back to the teres major after subscapularis. But if you look on the left-hand side of the picture, you'll notice teres minor is on the lateral border. And then if you look on the right-hand side of the picture, teres major is also on the lateral border, but it is below it. So teres minor is above teres major. All right. Teres minor attaches to the greater tubercle. Teres minor attaches to the lesser tubercle. So they have two different insertion points, but they come from the same area. So teres minor. And I would show you both pictures. All right. I would show you both pictures, or I would show you a model with both so that you have an understanding of which is which. I won't just give you one of them. The final rotator cuff muscle is the subscapularis. Subscapularis is on the anterior side of the scapula. Comes from the subscapular fossa. And subscapularis attaches to the lesser tubercle, just like teres major. The biceps brachii. Well, biceps brachii, you know this one. It's your Popeye. It's your big muscle in your forearm. Biceps brachii has two heads. It has a long head and a short head. The long head comes off of the supraglenoid tubercle above the glenoid fossa, and the short head comes off the coracoid process. It goes into they connect basically within the forearm, and then it inserts into the radial tuberosity of the radius bone. The biceps do three things. The biceps brachii does three things. It flexes the shoulder, it flexes the elbow, and it supinates the forearm. You've got to know those three things. It's very important. Shoulder flexion, elbow flexion, and forearm supination. Those are the three things that the biceps brachii does. Brachialis is also an elbow flexor. All right, brachialis is also an elbow flexor. This muscle comes from the center of the humerus and attaches on the ulna bone. All right. Believe it or not, this is really the most important of the elbow flexors. And we actually have 3 elbow flexors. We'll be talking about brachioradialis in a few minutes. All right. But brachialis, a smaller elbow flexor. Notice from the picture, brachialis, there is no way you can do anything at the shoulder. It doesn't cross the shoulder joint. Where, take a look at the biceps brachii. It crosses the shoulder joint and it crosses the elbow joint. So which means it's going to have actions at both the shoulder and the elbow. Brachialis, on the other hand, is only going to have an action at the elbow. The triceps brachii. This is a 3-headed muscle. All right, the triceps are on the posterior side of the humerus. It's basically the opposite of the biceps brachii. All right, the long head of the triceps is on the infraglenoid tubercle of the scapula, below the glenoid fossa. The other 2 heads are on the humerus itself. It inserts into the olecranon process of the ulna. So it inserts into the pointy part of your elbow. This too has actions at the elbow and at the shoulder, and they're both the same. It extends the shoulder and it extends the elbow. Flexor carpi ulnaris. So a lot of the forearm muscles are going to tell you what they do and where they are. So there are certain origins when we're talking about forearm muscles. The medial epicondyle of the humerus is the common flexor tendon, and the lateral epicondyle of the humerus is the common extensor tendon. That's where most of those tendons, that's where their origins are. Flexor carpi ulnaris, of course, is not there. It's not on the medial, part of it is on the medial epicondyle, but also part of it is on the ulna. So what this muscle does is it flexes the wrist. All right, it flexes the wrist, and it does ulnar deviation, where it deviates, where the wrist deviates to the pinky side. Whenever you see carpi, what that means is that the muscle inserts onto the carpals. It inserts onto the wrist bones. This muscle does not do anything at the fingers. Does nothing at the fingers because it stops at the wrist. Stops at the wrist. So this is a flexor of the wrist and an ulnar deviator. Well, it says it's flexor carpi ulnaris. So it's going to be on the ulnar side, which means it inserts most likely either close to the 5th digit or close to the 4th carpal. Well, it goes to the base of the 5th metacarpal, the pisiform actually. So this is a flexor that inserts on the wrist on the ulnar side. That's what it's telling you. The name is telling you a lot. All right, the name is telling you a lot. So if I put an insertion point at carpals on the radial side, well, it can't be that. The carpal's got to be on the ulnar side. That's why it's important to know the carpals in those rows. So that proximal rotor, scaphoid, lunate, triquetrum, and pisiform. Pisiform is closest to the ulnar side bone. So flexor carpi ulnaris, flexor carpi radialis. Again, it's a flexor of the wrist. It inserts onto the carpals of the wrist, and it's on the radial side, which it means it's going to be close to the second or maybe even the third digit. In this case, it inserts onto the second metacarpal. So again, flexor carpi radialis, flexor of the wrist, also a radial deviator. It does nothing at the fingers, nothing at the fingers. Brachioradialis. Brachioradialis is the third elbow flexor. This one, the origin is on the lateral supracondylar ridge of the humerus. It's a rough part of the humerus. It crosses the elbow and inserts onto the styloid process. Okay, how you doing, Bridget?
I'm good.
Excellent. So I want you guys to try this. I want you to hold your palms up like this with your forearm, all right? And I want you to flex your elbow. And with your other hand, I want you to feel your bicep muscle. What do you feel with your bicep muscle? Are you feeling it move?
It moves up and down.
It moves up and down. Guess what? I bet you I can get rid of it. This is what I want you to do. I want you to turn your palm downwards and do the same thing. Feel your bicep muscle. Does it feel the same? Do you feel it at all?
No.
No. It's the same movement though. I'm flexing my elbow. Just by changing the hand position, I'm using a different muscle. So with my palms up, I use the biceps brachii. With my palms down, I use brachialis. And when I put my hand in a neutral position, I want you to handshake like you're shaking somebody's hand. And you do the same thing. Well, you're not using the biceps brachii, you're actually using brachioradialis. So, palms up, biceps brachii. Hand in a neutral position, shaking hands, brachioradialis. Palms down, brachialis. Pretty cool stuff. We'll get to that in kinesiology. Okay, so the brachioradialis goes from the humerus to the radial styloid process. Extensor carpi radialis. What do we have here on the list? Extensor carpi radialis longus. So extensor carpi radialis longus, all right, is off of the third here. So its origin is on the supracondylar ridge, and it inserts into the base of the third metacarpal. Again, the name tells you what it does. This is an extensor of the wrist. It does nothing at the fingers. Whenever it says carpi, that means it's stopping at the wrist. So it extends the wrist, and since it's on the radialis side, it does radial deviation. Radial deviation. Extensor carpi ulnaris. This is just the opposite side muscle. It's an extensor of the wrist. It inserts onto the carpals, in this case, the fifth metacarpal. It does nothing at the fingers, which means the only job of this muscle is to do wrist extension and ulnar deviation. So again, the name of the muscle is going to tell you what it does, where it inserts, and what side it is. So even if you don't memorize it, it's going to give you an idea. Extensor digitorum. Now, this is a different muscle. This is an extensor, but this one is going to the digits. It's telling you, extensor digitorum is going to the fingers. So this muscle is going to extend the wrist and also extend the fingers. Extends the wrist and extends the fingers. Extensor digitorum starts at the lateral epicondyle. Again, I don't know if you were here, Bridget, but the common flexor tendon for the forearm is the medial epicondyle of the humerus, and the common extensor tendon is the lateral epicondyle of the humerus. That's where you'll find these forearm muscles coming from. All right, so if it's a flexor, it's going to come off the medial epicondyle, and if it's an extender, it's usually going to come off of the lateral epicondyle. Now, I'm adding these two muscles in because they're different. And the reason I'm adding them is because I'm not going to add them to your practical, but I want you to get an understanding of them. The first one is flexor digitorum superficialis. So again, this is telling you this is going to be a flexor. It goes to the digits, which means it's going to flex the digits. So just by that, flexor digitorum, I know it's going to flex the wrist, and I know it's flexing the digits. But it doesn't flex all of the joints of the digits. Superficialis inserts onto the proximal interphalangeal joint. What that means is that I'm going to be able to flex my wrist, but I'm only going to be able to flex to the proximal interphalangeal joint. Superficialis does not flex the DIP, which is the top. All right? This is the DIP flexing. Superficialis cannot do that because it inserts on the PIP. It doesn't go to the DIP. And this is where on the national exam they get you. So I want to introduce this early on. So superficialis, flexor digitorum superficialis, inserts up to the PIP. Doesn't do the DIP. The next muscle, though, flexor digitorum profundus, flexes all the joints of the finger, including the DIP. So profundus does DIP, superficialis does not. These will not be on your practical. I just want you to get an understanding of them. So we're going to talk about the muscles of the back. So a muscle that I added on was erector spinae. The erector spinae group help with extending the back. The erector spinae is basically made up of 3 muscles. And they run through the entire back from the cervical all the way down to the lumbar area. Now, these 3 muscles, they're iliocostalis. Iliocostalis is closest to the spine, to the spinal cord. Longissimus is next to iliocostalis in the middle. I'm sorry, my apologies. Spinalis is closest to the spinal cord. So spinal, spinalis. Longissimus is in the middle. Iliocostalis is the most lateral. When you see costalis, costa, ribs. So with the erector spinae, the spinalis is closest to the spine. Longissimus is between spinalis and iliocostalis, and iliocostalis is the lateral. And we'll show you pictures of that. So now let's get to the lower extremity. So now we're on the other half here. Gluteus maximus. When we're talking about the glute muscles, we're talking about 3 glutes: glute maximus, glute medius, and glute minimus. Glute max is the most superficial. Glute medius is in between, and glute minimus is the deepest of the 3. Glute max is the big strong buttocks muscle. That's right on top. And this muscle has a starting point, it has an origin on the iliac crest of the hip. So like I said, it's really important to know all of these other landmarks. So glute max is on the iliac crest. Glute medius is right below the iliac crest. So you see here, this on the picture here, how the iliac crest is completely empty and the muscle is underneath the iliac crest. So glute medius is deeper to glute max. Glute max is on the iliac crest. Glute medius is under the iliac crest. Glute minimus rid of that. Glute minimus is deeper to medius. As you can see, it's even further down in the ilium. All right, it's even further down in the ilium. So here's glute minimus down here. Glute medius was up here, and glute max was on the iliac crest. So again, max is superficial, medius is between, minimus is the deepest. Okay, so those are your 3 glute muscles. And again, I'm going to show it on with the cards in a few minutes. Your tensor fascia lata. This is a small muscle that comes from the iliac crest and it attaches to the iliotibial band. Very small muscle. It's on the lateral side of the leg. All right, on the lateral side of the leg, close to the glute max. The piriformis. This is one of the rotators of the hip. This is a lateral rotator of the hip. This muscle is a muscle we work on a lot as PTAs. This muscle comes from the anterior side of the sacrum and attaches to the greater trochanter. So you can see here how it's on the front side of the sacrum and it attaches to that large projection on the femur. Okay, it's a very small muscle, but if you take a look at where it's at, this muscle is very important. When somebody complains of sciatic pain, it's usual, as you can see, these areas down here, these ropes, well, these are pictures of nerves. What these nerves are coming out of the spinal cord up here. Well, sometimes that piriformis sits on these nerves, sits on the sciatic nerve, causing pain and numbness into the upper leg and even the lower leg, and pain that is excruciating. Anybody's ever had sciatic pain, you'll know what I'm talking about. Incredibly painful. Well, the piriformis sometimes sits on the sciatic nerve. So it's a muscle that we work on a lot as physical therapist assistants. The sartorius muscle. This muscle is known as the talar muscle. All right. This is a very long muscle. This muscle comes from the anterior superior iliac spine and attaches on the front of the tibia, literally next to the tibial tuberosity, but not on it. It's an area known as the pes anserine. This is the longest muscle. It looks like a strap, all right? And it's the most superficial muscle. It's more superficial than the rectus femoris. So sartorius starts at the ASIS. The rectus femoris actually starts at the AIIS. So it's an important distinction between those two muscles. The iliopsoas is a combination muscle between the psoas major and the iliacus. Both of those muscles kind of do the same thing and they're in the same area. So what has been decided is that we'll just put these two muscles together. So they call it the iliopsoas, and the iliopsoas is the most powerful hip flexor in the body. So it literally starts from the lumbar vertebra and goes all the way down and attaches onto the lesser trochanter. So it's a very important hip flexor in the body. We do have adductors of the body, and one of the adductors that we're going to want you to know is the adductor longus. Adductor longus comes off of the pubic area and attaches to the posterior portion of the femur. Remember, when we went over the landmarks of the bone, we spoke about there's a ridged area on the posterior portion of the femur known as the linea aspera. Well, the adductor longus attaches to that linea aspera, and it's the adductor longus with the other adductors that bring the leg back after performing abduction. Gracilis is another long muscle on the anterior side. This muscle starts from the pubis and it attaches to, again, that pes anserine where the sartorius inserts into. That, again, is on the anterior proximal portion of the tibia. This muscle, too, does a lot of actions. It adducts the hip. It flexes the knee. It flexes the hip. Again, another long muscle. This is a straight muscle where sartorius is kind of curved. So the gracilis muscle. When we're talking about the knee, the first muscle of importance is the rectus femoris. This is part of the quadriceps muscle. Remember, I said the rectus femoris has an origin at the AIIS, which is different from sartorius. It inserts into the patella tendon and then into the tibial tuberosity of the tibia. The rectus femoris is a two-joint muscle. Remember, the quadricep is made up of four muscles. Rectus femoris and the next three that we're going to show. But of the quadriceps muscle, the only quadricep muscle that has an effect on the hip is the rectus femoris because it crosses the hip joint. Rectus femoris flexes the hip and extends the knee. All right. So rectus femoris. The other three muscles of the vastus are the vastus medius, intermedius, and lateralis. Again, telling you direction. Vastus medius is on the medial side of the leg. Vastus lateralis is on the lateral side, and vastus intermedius is between the two, with rectus femoris going over the top of that, and sartorius being more superficial to that. The vastus only extend the knee. Remember, it has nothing to do with the hip because their origin is on the femur itself. It doesn't cross the hip bone. The hamstring muscles, they all come from the same place. They all come from the ischial tuberosity, but they end up in different areas. The semimembranosus and semitendinosus are on the medial side of the leg. Again, semimembranosus and semitendinosus are on the medial side of the leg. But semitendinosus is the only one that you can really palpate on the medial side of the leg. It's more superficial. So semitendinosus is more superficial. Also about semitendinosus, it inserts onto the front side of the tibia, that same area known as the pes anserine, where the gracilis and sartorius also insert into. So there are three muscles that insert into the pes anserine area, and you'll need to know that. Semimembranosus inserts into the condyle of the tibia. Semimembranosus inserts into the medial condyle of the tibia. The other muscle of the hamstrings is the biceps femoris. And again, you've got to explain, there's going to be, you got to tell a difference between biceps brachii and biceps femoris. So you got to call the hamstring muscle biceps femoris. You can't just call it biceps. Biceps femoris is on the lateral side of the leg, on the lateral side of the leg. And it's another muscle you will be able to palpate. Biceps femoris, again, comes from the same area as membranosus and tendinosus, comes from the ischial tuberosity. So the hamstrings not only flex the knee, but they extend the hip also as an important job function. Biceps femoris inserts into the fibula, to the head of the fibula. Remember, there was that small lateral bone. The ligaments of the knee, I just put it there. You guys aren't going to need to know it. We'll talk about that more tomorrow. The gastrocnemius, now we're talking about the calf muscle. So the gastroc is the more superficial calf muscle. It's the larger of the calf muscles. Okay, this muscle has an origin on the tibia. So this muscle also flexes the knee. So the gastroc flexes the knee and plantar flexes the ankle. So the gastroc plantar flexes the ankle. This is the larger of the two calf muscles. And more superficial. The deeper calf muscle is known as the soleus. Soleus is known as a fish. It looks like a fish, right? This muscle only has an action at the ankle. It only plantar flexes, okay? Its origin is on the tibia. It doesn't cross to the femur. So it has no action at the knee. So the gastroc has an action at the knee. Soleus does not. But both of the muscles perform plantar flexion of the ankle. Tibialis posterior. All right, this is a muscle that is on the posterior tibia and fibula. It inserts onto the base of the toes on the bottom of the foot. The tibialis posterior also plantar flexes the ankle. So gastroc, soleus, tibialis posterior are your main ankle plantar flexors. On the anterior side of the leg, we have the tibialis anterior. Tibialis anterior comes from the upper tibia and fibula. It crosses over to the medial side and attaches to the first metatarsal. Tibialis anterior is the main dorsiflexor of the ankle. The main dorsiflexor of the ankle. On the list, we have peroneus longus and peroneus brevis. These muscles are on the lateral side of the leg. All right. You might hear peroneus, also known as fibularis. All right. These muscles help with everting the foot, and they also assist with plantar flexing the ankle. When you're talking about the peroneus muscles, you're talking about lateral side muscles. All right. These muscles are on the fibula side. Again, fibularis, longus or brevis. It's the same thing. Fibularis and peroneus, they're the same. But if you know it as fibularis, you know that it's going to be on the fibula side, on the lateral side. Okay, and they both insert onto the fifth, brevis goes onto the fifth metatarsal, and longus actually cuts across and goes underneath the foot and goes to the first metatarsal. Extensor digitorum longus is the last of our muscles here. And again, like we talked about with the forearm, this name is telling you what it's going to do. First of all, if it's an extensor, it's on the top half of the foot. All right, it's on the anterior portion of the foot, the ventral, which means if it's going to do that, it's going to dorsiflex the ankle. All right, it's a long muscle. It starts all the way up on top of the tibia, close to the head of the fibula, and it goes to the four toes. So it dorsiflexes the foot and it extends digits 2 through 5. All right, so those are the 48 something muscles that we have for the practical. Let me get out of this for a second. What I want to do is I want to show what it looks like with the cards. It looks like with the come on, what do I want here? Let me stop the share. That'll get me into the, there we go. All right, so it looks like it's just you and I right now, Bridget. All right, so we're going to go through what these muscles look like on these cards. All right, so I'm going to kind of show them. So these are the flashcards that we have. So I'm going to show you the picture side, but on the other side, it has all the information about it. And I'll just show it to you off of the first card. So the first one we went over was sternocleidomastoid. All right. So on the card, it shows what the muscle looks like. Then on the bottom, it shows the origin and insertion of the muscle. So the origin is on the sternum and the clavicle, and it inserts onto the mastoid process. So that's what it looks like. And on the back, it gives all of the information for the sternocleidomastoid. The origin, the sternal head, and the clavicular head. It inserts into the mastoid process, also inserts into the nuchal line. Its actions, well, when they work together, they flex the neck. When they work unilaterally, it laterally flexes to the neck to the same side, and it rotates the neck to the opposite side. And what that means is that if I'm looking at my right sternocleidomastoid, all right, I'm looking at the right one. The right one will flex to the same side and will rotate to the opposite side. So if you feel your neck, Bridget, right over here, there's a muscle here. What I want you to do is bring your right ear to your right shoulder, and you'll feel the muscle activate. And then turn your head like you're saying no to the left, and you will feel that same muscle activate. If you were to rotate your head to the right, that muscle will not work. Okay? So it's very important to understand how these muscles work. This muscle is the muscle that young children get. When this muscle is tight, they get torticollis, and torticollis is where the child is flexed, laterally rotated. I'm sorry, laterally flexed and rotated. They look like this. And we actually have to teach our parents how to stretch them. So torticollis, a very, very important disease process that has to do with the sternocleidomastoid muscle. The next muscle is pectoralis major. All right, as you can see here, the pec major has its origin on the sternum and on the clavicle, and it inserts onto the humerus. Again, this is what, if I was to put this picture down, this is what I would do. I would put a number underneath the picture, number 2, and you would say number 2 is the pectoralis major, and I'd say, good, let's go on to the next one. Okay, so that's the pectoralis major. Next muscle is the pectoralis minor. Pectoralis minor is deep to the pec major. This muscle is coming from ribs 3, 4, and 5 and inserts onto the coracoid process. And you can see on the bottom where those lines are on the ribs, and that small little line is on the coracoid process. That's the O and the I, the origin and insertion. This is the latissimus dorsi. Latissimus dorsi is a wide muscle, very expansive. It has many, many origins, such as the vertebra, lower thoracic and lumbar vertebra, the iliac crest, the lower 4 ribs, the inferior angle. And this muscle, even though it comes from the back, has an important action at the shoulder. The latissimus dorsi is an important shoulder extender, because as you can see, that muscle attaches to the humerus. See how that muscle, it kind of does a little spin and goes to the front of the humerus. It actually inserts into the bicipital groove. So latissimus dorsi is an important extender of the shoulder. This is the trapezius muscle. All right. If you look on the right-hand side top of the picture, it's showing the trapezius on one side, going from the occiput, and then the middle, and then the lower trapezius. will probably find a better picture of this. This isn't the greatest picture, but again, if you look on the bottom, it shows its multiple origins, starting from the occiput, going into the lower thoracic area, and how it inserts. It actually inserts into the clavicle, into the acromion process, and into the spine of the scapula. Very expansive muscle, very large muscle. I don't like that picture. I'll probably put a better picture on there. I spoke about the rhomboids. I'm not going to split them up into rhomboid minor and rhomboid major. On the cards, they do. You'll notice on the sheet, it's just rhomboids. So here's the rhomboid minor. All right, the rhomboid minor starts from the spinous processes of C7 to T1. And then rhomboid major goes from T1 to, I'm sorry, from T2 to T5. Well, I'm going to want you to just combine them. It goes from C7 to T5, and then from the spine of the scapula to the inferior angle. So when I will find a picture of putting them together, where it'll be the rhomboid major and minor will be just rhomboids. Okay, so you'll have to know that they come from the spinous process and they're on a diagonal. They insert into the medial border of the scapula. Here's the serratus anterior. These muscles, this muscle comes from the first 9 ribs, and this muscle also attaches to the medial border of the scapula. This muscle actually goes underneath the scapula on the anterior side. So that's what the serratus anterior looks like. Here's a picture of the deltoid. This is the type of picture I will use on the practical. But when we're talking about the deltoid, it's really made up of 3 muscles, just like the trapezius is made up of 3 muscles. Trapezius is upper, middle, and lower. The deltoid is made up of an anterior, middle, and posterior, because each of those sections does different things. They do different actions. So on your practical, this is what you'll need to know for the deltoid. But tomorrow, we're going to go over each of these muscles more in depth. We're going to talk about their actions. We're going to talk about their origins and insertions and how it relates to the bony landmarks. We spoke about the rotator cuff muscles. Remember the acronym SITS. Rotator cuff muscles are known as the sits muscles. We have 4 rotator cuff muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. The first of those muscles is the supraspinatus. Again, take a look at this muscle. Take a look at where it is. It's on the scapula. You're looking at the scapula from the posterior aspect. You know it's the posterior aspect because you can see the spine of the scapula. You see the muscle above the spine, hence the name, supraspinatus, above the spine. So supraspinatus is the first of the rotator cuff muscles. And again, that's the rotator cuff muscle that is mostly injured, that's most impinged. The infraspinatus, again, you can see this, it's a posterior look because you could see the spine of the scapula. The muscle is underneath the spine, hence infraspinatus, below the spine. That is the infraspinatus muscle. The T is the teres minor. teres minor is above the teres major. The teres major is going to be in this area here on the lateral border. It's going to be underneath it. Teres minor is above it on the lateral border. The supraspinatus, the infraspinatus, and the teres minor all insert onto the greater tubercle of the humerus. Those three insert into the greater tubercle. The final rotator cuff muscle, now we're looking from the anterior side. You could see the clavicle on the anterior side here. You can even see the sternum a little bit. So this is the anterior part of the scapula, and this is where the subscapularis is. And the subscapularis inserts into the lesser tubercle, inserts into the lesser tubercle of the humerus. Here is teres major. Teres major is just a thicker muscle. Again, it's more inferior to teres minor. Teres minor inserts into the greater tubercle. Teres major inserts into the lesser tubercle, just like subscapularis. I know it's very confusing. You're gonna have to start to know your muscles like that. All right, you're gonna have to know your muscles on where they are and what they do. This is the biceps brachii. All right, biceps, two muscles, bi. It has two origins. The long head is the supraglenoid tubercle. The short head is the coracoid process, and it inserts into the radial tuberosity on the radius bone. It has three actions. It does shoulder flexion, it does elbow flexion, and it does supination of the forearm. The biceps brachii. Another elbow flexor, really the workhorse of the elbow flexors, is the brachialis. This muscle goes from the middle of the humerus to the ulna, to the proximal ulna. And this muscle only does elbow flexion. As you can see, it has nothing to do with the shoulder, and it has nothing to do with the wrist. Its only action is at the elbow, and it only does elbow flexion. This muscle is the triceps brachii, three-headed muscle. The important origin that you need to know is that the long head comes off of the infraglenoid tubercle, below the glenoid fossa. It inserts onto the olecranon process, onto the pointy part of your elbow. This muscle crosses the shoulder and crosses the elbow, and the two important actions that the triceps do is that it extends the shoulder and it extends the elbow. Flexor carpi ulnaris. Again, it comes from the medial epicondyle, and it inserts into the base of the fifth metacarpal. Remember, ulnaris. Ulnaris means pinky. The ulnar bone is on the pinky side. So again, the name is telling you a lot. A flexor, this is going to be a flexor of the wrist. The muscle inserts close to the carpals, which means it does nothing at the fingers. All right, it inserts into the fifth metacarpal, and it's on the ulnar side. So it inserts into the fifth metacarpal. So the only things that flexor carpi ulnaris does is flex the wrist and ulnarly deviate. deviates towards the pinky side, towards the ulnar bone. Again, flexor carpi ulnaris. The name is going to help you. It's a flexor of the wrist. It does nothing at the fingers because it stops at the carpals or the metacarpals. And it's on the ulnar side, which means it's on the pinky side. Flexor carpi radialis, the complete opposite. Again, it's a flexor. It's going to come from the medial epicondyle. It's going to be a flexor of the wrist because it doesn't go to the fingers, because carpi is telling you it stops at the wrist, and you know it's going to be on the radial side. All right, which means the insertion is into the second and third metacarpals. So flexor carpi radialis does flexion of the wrist and radial deviation, deviation towards the radial side, towards the thumb side. Brachioradialis. Brachioradialis only does elbow flexion. Its origin is on the lower part of the humerus at the lateral supracondylar ridge, and it inserts onto the styloid process. It doesn't go past the wrist. It does not go past the wrist. It just goes to the styloid process of the radius. There are 3 elbow flexors: biceps brachii, brachialis, and brachioradialis. There are 4 shoulder flexors. So with the elbow flexors, I have an acronym for that as BBB: biceps brachii, brachioradialis, and brachialis. For shoulder flexors, my acronym is ABC and pec major. The A is the anterior deltoid. The B is the biceps brachii. The C is the coracobrachialis and pec major. Those are the 4 muscles that perform shoulder flexion. This muscle here is extensor carpi radialis brevis. Right? Extensor carpi, right. Well, I got longus. Give me 1 second. I got longus on here. Okay. Extensor carpi radialis longus. Remember, if it's a forearm extensor, it comes from the lateral epicondyle of the humerus. So its origin is going to be the lateral epicondyle of the humerus. If it's a carpi, it's only going to insert into the carpals of the wrist or the metacarpals. Has nothing to do with the fingers. And it's on the radial side, which means it's going to be digits 2 or 3. Okay, so it's going to extend the wrist, and it's on the radial side. It's going to radially deviate. Those are your actions. Its origin, again, well, the origin is the supracondylar ridge of the humerus, but it's close enough to the lateral epicondyle, and it inserts into the second metacarpal. So again, wrist extension, radial deviation. It does nothing at the fingers. Extensor carpi ulnaris. It's an extensor. It starts from the lateral epicondyle. It's a carpi. It only goes to the wrist, which means it does nothing at the fingers, which means it does wrist extension, definitely. It's an ulnaris, which means it's on the ulnar side, which means the other action is ulnar deviation. So the 2 actions is wrist extension and ulnar deviation. It's going to be on the ulnar side, which means it's going to be probably digits 4 or 5, where it's going to insert, and it inserts into the base of the 5th metacarpal. Extensor digitorum. Right, there's an extensor digitorum in both the hand and the foot. Whenever you hear digitorum, you're thinking of fingers and toes, the digits. So extensor digitorum means that it's going to extend the digits, going to extend the fingers, but it's also going to extend the wrist because it passes. In order to get to the fingers, it's got to pass the wrist. So don't forget that it does wrist extension too. Extensor digitorum goes to digits 2 through 5. It extends the digits and extends the wrist. All right. And you can see it there. Not really great, but you could see how the tendons go all the way to the top of those fingers. And that extends the digits. Extensor digitorum. Now, Bridget, were you here when I did the flexor digitorum profundus and superficialis?
Yes.
Okay. So again, with those two, it's telling you it's going to the fingers. Flexor digitorum. It's going to flex the fingers and it's going to flex the wrist. But again, they are different. And I'd rather start you guys and hear it now instead of, hearing it later. Flexor digitorum superficialis only goes to the PIP, the middle joint. So you can only do this at the fingers. You can only do this at the fingers. Superficialis can only do this. So I don't know if it'll show. It doesn't show it well. It shows it good, but I don't know if you can see it. But on the fingers there, you can see the tendons ending up in the middle digit, not the end. It's at the middle. That's superficialis. Profundus goes all the way to the end. It goes all the way to the DIP. So profundus allows this motion. That's the only muscle that will do this motion. Here, 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 and here. So flexor digitorum profundus flexes the DIP. Superficialis only goes to the PIP. Okay, when you get these, you'll be able to see it better, or look up on Wikipedia, flexor digitorum profundus, flexor digitorum superficialis, because there is a difference. This is the erector spinae group. So the set of muscles closest to the spine is spinalis. The middle is longissimus, and the most lateral is iliocostalis. And again, the names kind of help you with guiding you where these muscles are at. Erector spinae has 3 different muscles. Spinalis, spine. That's the one that's going to be closest to the spine. Iliocostalis. Costal means ribs. Those are going to be closest to the ribs. Those are going to be most lateral. And in between is longissimus. And that name doesn't help you much. But if you know where spinalis is and you know where iliocostalis is, longissimus is right in between those two. So that's the erector spinae group. All right. So on your cards, you'll have a spinalis, you'll have a longissimus, and an iliocostalis. So you'll be able to see them all separately. This is the gluteus maximus. Remember when we spoke about glute max, its origin is really on the iliac crest. It's a large muscle. It is the most superficial of the gluteus muscles. Directly underneath glute max is glute medius. Glute medius is not on the iliac crest. That's what that space is on the top. It's directly below it. Again, glute medius is deep to glute max. Finally, glute minimus is even further down the ilium. So you'll notice that the iliac crest and the upper part of the ilium is pretty open. Gluteus minimus is the deepest of the three glute muscles. And again, we'll go over what all of these muscles do over the next couple of days. Again, so again, what I'm doing is I'm going over just your muscles on the practical. Again, all you got to do is identify it. You're not going to have to give me origin and insertion and actions and stuff. That will be on the tests. The next muscle is the tensor fascia lata. Sounds like a cup of coffee. The TFL is a very small muscle. It starts at the iliac crest. All right. Its origin is anterior to the ASIS, and it inserts onto the iliotibial band. It's that small dark area right here. Sorry, this is the small muscle right here. All right, that small muscle. That's the TFL, the tensor fascia lata. It's on the lateral side of the body. This is the piriformis. The piriformis starts on the anterior sacrum, inserts into the greater trochanter of the femur. This is an important muscle because when it is not in a good position, it puts pressure on the sciatic nerve, which can cause a great deal of pain into the buttocks, the back of the thigh, the back of the calf, even into the foot. So piriformis is one of those muscles we do a lot of stretching with in order to alleviate sciatic pain. This is the sartorius muscle. It's the longest muscle in the body. It's very strap-like. It has multiple actions, but it is the most superficial of the anterior muscles, sartorius and the quadriceps. Sartorius is more superficial. And sartorius has an origin at the ASIS, the anterior superior iliac spine. And it's different than the origin of the rectus femoris. Sartorius inserts into the anterior portion of the tibia, and that area is known as the pes anserine. And the pes anserine has three muscles that attach there. So the first of those muscles is the sartorius. All right, long strap-like muscle that crosses the anterior portion of the leg. Remember I said that we combined the psoas major and the iliacus, and basically we created the iliopsoas muscle. The iliopsoas muscle goes from the lumbar vertebra all the way down to the lesser trochanter, and it's the major hip flexor. So here's the iliacus muscle. As you can see, iliacus comes from the iliac fossa, and it attaches to the lesser trochanter. And the psoas major comes from the lumbar vertebra and attaches to the lesser trochanter. So what they decided was, since those two muscles basically come from the same area, go to the same area, and do the same thing, we'll think of it more of as a combined muscle. So iliopsoas is the strongest hip flexor. Adductor longus comes from the pubis area and attaches to the linea aspera on the femur. And this muscle helps with adduction of the leg. The gracilis is on the medial side of the leg, right? More towards the anterior medial side. Its origin is on the pubis, and this muscle too inserts into the pes anserine on the anterior side of the leg. So now we got two of the muscles here on the pes anserine, the sartorius and the gracilis. Vastus muscle. It's rectus. The rectus femoris, probably the most important of the quadricep muscles. The rectus femoris is the only muscle that has two actions in the quadriceps. The rectus femoris extends the knee and can flex the hip. And the reason is because the origin of rectus femoris is the AIIS, the anterior inferior iliac spine of the hip. Remember, sartorius is ASIS. The rectus inserts into the tibial tuberosity via the patellar ligament. Okay, so the rectus femoris is the only quad muscle that has an action at the hip. There are the other three muscles of the quadricep are the vastus muscles. Again, vastus intermedius, which is closest to the femur, and that's in between the vastus lateralis, which is on the lateral side, and the vastus medialis, which is on the medial side. Again, the vastus muscles only do knee extension. It has no action at the hip. Going to the back of the thigh, now we're talking about the hamstrings. There are three hamstring muscles. They all come from the same place. Each of them has an origin on the ischial tuberosity, but all three have different insertion points. The semitendinosus, again, comes from the ischial tuberosity. It is on the medial side, and it inserts into the pes anserine, into the anterior portion of the tibia. So the semitendinosus is the third muscle that inserts into the pes anserine. Sartorius, gracilis, and semitendinosus. Semimembranosus. Membranosus is also on the medial side. Also comes from the ischial tuberosity, but its insertion point is into the medial condyle of the tibia. So it's basically on the top portion of the tibia. Okay, medial portion of the tibia. That's membranosus. And finally, we have biceps femoris. Biceps femoris is on the lateral side of the thigh, and it inserts into the fibula head. It also has its origin at the ischial tuberosity. Semitendinosus on the medial side and biceps femoris on the lateral side are two tendons that you can palpate. Semimembranosus is very deep, tough to palpate, unless they're very, very thin. If they're very, very thin, there's a chance you'll be able to palpate membranosus under the tendinosus. This is the gastrocnemius. Gastrocnemius is the large calf muscle This too is a two joint muscle. Its origin is on the tibia and the fibula. So it has an action at the knee. It flexes the knee and it plantar flexes the ankle. So gastroc, sorry, this is gastroc here, my apologies. Gastroc here, as you can see, it's going over the knee joint and it's double and it has two heads. Gastroc goes over the knee joint, so it flexes the knee and it attaches at the calcaneus, which means it plantar flexes the ankle. It brings the toes towards the ground. This is the soleus. The soleus attaches to the tibia. Its only action is plantar flexion. It has no action at the knee. And soleus is deep to gastroc. This is the tibialis posterior muscle. As you can see, it's on the back side, right? Its origin is the shaft of the tibia and fibula, and it attaches to the 5 tarsal bones at the base of the metatarsals. All right, tibialis posterior also helps plantar flex the foot. So gastroc, soleus, tibialis posterior are all plantar flexors. Tibialis posterior also inverts the foot also. This is tibialis anterior. Its origin is the superior tibia and fibula. It actually crosses over to the first metatarsal of on the foot. Its main action is that it dorsiflexes the foot. It dorsiflexes the foot. But because it's on that first metatarsal, it also inverts the foot. Now, you'll hear it later if you hear the recording, Bridget, but I spoke about how muscles contract. Muscles contract where the insertion comes closer to the origin. All right. So when you're picturing a muscle and so the origin, so let's just take tibialis anterior. All right. So the origin is up here. The insertion is down here. If the insertion comes closer to the origin, it's moving it up, hence dorsiflexion, and the foot will invert. So again, the way muscles work is that the insertion is coming closer to the origin. So you got to start to picture it that way when you're looking at muscles. The peroneus brevis and longus, also known as fibularis brevis and longus. And if I were you guys, I would remember it as fibularis because it's telling you what side the muscle is on. It's on the fibula side. It's on the lateral side. So this is fibularis brevis. This is the smaller of the two. It starts halfway up the fibula and it inserts onto the 5th metatarsal. This muscle also helps plantar flex. And since it's on the lateral part of the foot, it everts the foot. So brevis everts the foot. Fibularis longus is longer. It also plantar flexes the foot and everts the foot. So the fibularis or peroneus muscles, they both plantar flex the ankle and evert the foot. Last one, we have extensor extensor digitorum longus. So just like the fingers, the name tells you a lot. This is going to be an extensor of the digits. It's on the top of the foot. If it's on the top of the foot, it's going to bring the foot up like this, which means extensor digitorum not only extends digits 2 through 5, but it also dorsiflexes the foot. Again, if I was to bring this insertion towards the origin, bringing it up, the toes would go up, and that is dorsiflexion of the ankle. This muscle also everts the foot. So those are all the muscles that you guys will be required to know for your practical, for the practical. Tomorrow, I'm going to start going over these muscles: origin, insertion, actions, and innervation, because it'll be that information that's going to be on my quizzes. You didn't hear me earlier. I've decided already to change the date on the bone practical. We are now moving the bone practical to the second week. It'll be the Thursday of week 2, and the muscle practical will be the Wednesday of week 4. So the original dates were in week 1 and week 3. So we're giving you guys more time. So you guys should be okay. And that's it for today. Oh, I made it to 2 hours perfectly. Bridget, any questions?
Nope, I'm all good. Thank you.
All right. I will load this up, and as soon as I finish loading, I will send it out to everybody. I'm not going to send out the lecture because there's so many more muscles you guys are going to need to know. I'll send out tomorrow's lecture because that has all of the muscles that you guys are going to need to know. So it doesn't make sense to send out a half a lecture. Okay? All right. If you have any questions, please feel free to email me. I really do try to get back to you guys quick. Have a good evening. Thank you for coming, Bridget.
Thank you.
And everybody, we'll see you tomorrow. Have a nice evening. Stay safe and stay healthy.